If you suffer from varicose or spider veins, they can be very painful, unsightly. But here to help, lucky for us, is Marissa Tufferillo, PA at Dr. Mackay, vein and circulation specialist, who's here to explain. Marissa, how are you first?
Good, how are you?
Good. I'm glad you are here because you are tackling a topic that I got to be honest with you. I've heard these terms, but I really don't know a lot about them. So first, let's talk veins in general. What is it about the veins in the legs that just seem to cause problems?
Well, in our legs we have arteries and we have veins, and the arteries work to bring blood to the feet, and blood travels through the arteries based on the pressure from pumping of the heart. The veins, unlike arteries, work to bring blood back upwards towards the heart and have to work against gravity. And the veins rely on the calf muscle pump. When we walk, we're pushing blood up in the right direction. And we also rely on the valves in the veins. And if the valves start to fail, blood goes in the wrong direction and it pools. And as the blood pools, there's increased pressure and the patients will experience a lot of symptoms.
Time out. Is that why with pregnancy and being 9 months pregnant right now, I'm having some of the issues and that's one of the pregnancy signs?
Absolutely.
Okay, Marissa's starting to explain it to me so that I can understand a little bit what's going on. So now we understand how the veins work, but the issues that can arise, I mean, sounds a little intimidating.
Right, so as the blood is pooling from backwards blood flow and pressure is building up, there's basically toxic metabolic waste products that are sitting in your lower legs. And with that, iron can deposit into your skin and you can get brown discoloration of the skin. And the symptoms that someone would experience is heaviness, aching, fatigue, particularly after you stand or sit for long periods of time.
I would say that sounds really icky. And that's what I was going to ask, like, when do you know if that's what's going on inside or not? So you do see the discoloration?
Well, not necessarily. So those are in later stages of the disease. In the beginning, you might just notice some tired or achy legs or some swelling at the ankles, which usually gets worse after, towards the end of the day after you've been on your feet and sitting or standing stationary. That swelling usually goes away in the morning because when you're laying in bed at night, there's no venous pressure.
Right, right. So when does a person, and maybe someone at home, or when does a person say, okay, I think I might need to get some help, or I might need to give you guys a call?
Well, if you're experiencing any of those symptoms, or if you see any spider veins or bulging veins or swelling at your ankles, you can actually come to our office. We do a free screening, and then we can do the proper evaluation and whatever treatment is recommended.
Well, lucky for us, you are going to come back, but before we let you go on this one, I would love to know, what are some of those treatment options? What can people expect?
Well, when you come to our office, we do a complete ultrasound. It's a diagnostic ultrasound. It's not just a typical ultrasound to look for a blood clot, but it's very detailed. We sit the patient, stand the patient, we're augmenting the legs to look at the direction of the blood flow and determining where the leaky valves are and where the problem is coming from. And then as far as treatment options, it really depends on the patient's anatomy, whether they would benefit from some type of procedure, including an ablation with radiofrequency or laser, or if they need some types of sclerotherapy, which are just injections to shut veins down. So it really depends on the patient's anatomy, their symptoms, and we can determine what they would best benefit from.
I'll say that consultation sounds like it's key. Well, if you want even more information that Marissa just applied, or you want to go ahead and even visit one of their 3 locations, 727-527-2888, Dr. Mackay and Marissa will have you covered.